I was diagnosed with irritable bowel syndrome, with diverticuli. I'm telling you, you just loaded up. You are backed up bad lymphatically. You know, when your adrenals are that low, you can also understand that your lymph system is greatly backed up because your kidneys aren't filtering. You can count on it. And this is just the areas that it's showing you in your face, the same thing. Your gut's all backed up lymphatically, interstitial, lymphatic, constipation. It's exactly what you're dealing with here, dear one. I must add that I am always very bloated, no kidding, and very gassy. Probably a lot of sulfur in you as well, dear. I would do, get your stomach and bowel number, whatever will move you, probably at least a number 3 probably. Tear it up with the GI broom. I do the lymphatic 1 capsules, tear it up with those, and really hit the adrenals hard, the kidneys, and really start moving that lymph and pull all that out. Your bowel pockets might be a parathyroid here too. If you're that low on the adrenals and the pituitary's involved, it could also be slamming thyroid and parathyroid. What apart from exercising, I wouldn't exercise right now. I'd settle down and start thinking about how do I move lymph chemically and magnetically, not through activity, because you're trying to make something happen that won't happen, and you're going to get worse by doing it. You can't exercise your kidneys and adrenals well. Impossible. And that's where man has to stop and think. You can't make everything happen through exercise. You cannot do it. And I've been over with physical therapists, and finally some people are getting it out there. Rest for a while you work on this like all the other animals. Get your kidneys and adrenals up and filtering, and then you go out and pound the pavement. But wait until you get it filtering, or you're doing yourself an injustice here. Look at what the animals do in nature. They rest when they're sick. I've got a friend due to have elective surgery on diverticulitis, which is inflammation of bowel pockets, basically, diverticulum. And he is 45 years old, has severe irritation that has him put in the hospital for several days and rounds of antibiotics. And remember, the more we do antibiotics, the more we actually suppress the lymph system and exacerbate the problem. He eats a sad American diet, which is high in protein and garbage. Well, he needs to change. You can let him listen to this, my friend, but high protein diet only served to irritate those diverticulums even more. Plus, a lot of this is probably coming from the inside out. Remember, in the wall where all the cells are, that's where the lymph system is. Even though his connective tissue is weak, when you herniate tissue, whether it's a bowel pocket or prolapsus or spastic conditions, all these type of herniations, whether it's varicose veins or spider veins. Remember, we're going to the parathyroid gland and the body's inability to utilize calcium, keeping in mind that the reason we're losing calcium out of structure is always acidosis. So that always has to be rectified, obviously, but it doesn't hurt to bring up that parathyroid a little bit so we can utilize calcium. I mean, in a while, those bowel pockets will become the bowel wall again. You can keep cutting out your bowels, but, colon cancers or surgeries aren't always fun. And then you got the neurotoxic effect of anesthesia. So you got all these issues to deal with. Or is it better to change your diet, my friend, and get your bowels healthy? Because this could be indication that you're systemically involved lymphatically, and that creates a lot of problems. Remember, most cancers are lymphomas. I told him to juice because almost everything he eats irritates his bowels. Yeah, I would do the slippery elm marshmallow tea, the heal-all tea if you can tolerate it. We use that for that sort of thing. I was diagnosed with diverticulitis. I am 32 years old, average weight. I was wondering what you suggest. Well, that's Kate, honey. The stomach and bowel formula is excellent for that. Look for other signs of connective tissue weakness. Look for fingernails. Look for spider veins, varicose veins. Look for hemorrhoids. If you start to see a connection, depression, if you start to see a connection between this, I would suggest taking something for your parathyroid to strengthen that parathyroid up, and it'll start strengthening connective tissue. At the same time, you're going to clean out those bowel pockets. You're going to clean that colon out in terms of on the wall. So that's where Heal-All capsules are good, Lymphatic 1 capsules are good, and of course stomach and bowel, whichever one suits you, is good. If you're moving your bowels good, stomach and bowel number 1 is the one I highly recommend. Number 2 has a little cascara sagrada in it, if in case you just need a little help. What these formulas are designed to do is clean those pockets out of impactions. Some people do have impactions, like it or not, and you can get some old moldy stool out of the bowel wall, the mucoid plaque you've heard so much about. Use these bowel formulas and get on the fruits, whatever ones that doesn't bother you too much. Stay away from the nuts anyway. Stay away from the seeds. Stay away from that side of that. If vegetables bother you too much, if it's real inflamed, then you want to do your vegetable juices and your fruits. Your subacid fruits would be real good, even your sweet fruits, and start using those herbs to clean that wall off, particularly stomach and bowel, say number 1 or 2, and lymphatic number 1 capsules. A little aggressive, those lymphatic 1 capsules, but they'll start pulling on that bowel wall as well. If that's too strong, then you do your Heal All tea capsules, which are a little puller, a lot of anti-inflammatories, a lot of healers, a lot of cleaners. And I would work that way, and then go to your kidneys, go to your adrenals, and always move your lymph. Always work on that side, no matter what else you're specifically going after, and you'll be okay. You'll pull your bowels out of that, and strengthen the connective tissue in your body, because a lot of times bowel walls herniate, if you will, and then you start using that as a filler. I think if you're overweight or you're too thin, either one, they're both problems in a lot of people. Just change that consciousness from trying to lose weight or gain weight to, I want to be healthy. Change it to a positive focus. And in that positive focus, there will be the spirituality, there will be the health, there will be the vitality, and your emotions will go on to another level. Definitely work on your adrenal glands, and definitely work on your kidneys, sweetheart, and really, get into that body, get on the raw. You'll never have to worry about weight, but you don't want to malabsorb yourself and you get caught up into those kind of fetishes, because it's unimportant. It's unimportant what people think about you. It's unimportant. You're a divine soul. That's all that matters. You love yourself. That's all that matters.